We are proud to, once again, have another primary healthcare initiative, the opening of the Scarborough Health Center. We just completed the Roxborough walk-in service, and there are other centers to be opened very soon. So we are proud to share this moment with you from the sake of letting you understand that things are happening in healthcare for the good and the betterment of our people. I wish to invite at this time to do the welcome our administrator in the Division of Health and Social Services, Ms. Heather Caruth. Could we welcome her with a round of applause, please?
I wish to acknowledge the presence of the Honorable Chief Secretary, Mr. Orville London, our other members of the head table, the Assistant Secretary in the Division of Health and Social Services with special responsibility for social services, Mr. Huey Cadet, Chairman of TRHA, Mr. Keith Charles, CEO of TRHA, Mr. George Bell, Mr. Honorable Whitney Alfred, Secretary for Settlements and Labor, Honorable Godwin Adams, Secretary for Public Infrastructure, Utilities, our distinguished administrators, Mr. Errol Caesar, Ms. Ethelyn John, our advisor to the Secretary, Dr. Angus, Dr. Denise Soyafat Angus, our AO5, Ms. Alison Lawrence, our CMOH, Dr. Radix, the general managers of the TRHA, I'm seeing Mr. Paul Taylor, I'm seeing Dr. Ayebuna, our primary health doctor, I'm seeing my director, and sorry, Mr. Casey Roberts, representative for the Minister for Tobago Development. I was going to batch you in the Ministers of Religion and not with the Minister for Tobago Development. Others, senior members of staff, Dr. Parilon, the medical chief of staff, our nurses, our nursing assistants, other senior officers in the Division of Health and Social Services, Ms. Sandra Crooks, our A2, representing the Division of Education, Youth Affairs and Sport, Mr. Jason Clark from the Disability Affairs Unit. I'm just calling persons randomly. I welcome each and every one of you. I'm not seeing the Technical Vocational Center for Persons with Disabilities. Oh yes, they're here. I welcome each and every one of you to this auspicious occasion. This is truly a great moment in Tobago. I don't know how you all are feeling, but I am feeling great. This is a beautiful building that we all should be very proud of. And you know something? I am speaking directly now to the medical workers, the workers of this institution, inclusive of cleaners, drivers, messengers, dentists, pharmacists, nursing assistants, nurses, doctors, clerical officers, front desk operators. With a building like this, you have no reason to be absent from work. With a building like this, you have no reason to be late at work. And we welcome the Secretary for Education, Youth Affairs and Sport, the Honorable Claudia Groom-Duke. With a building like this, you have no right to be irregular at work. Now, everyone who works with me knows that I stand for punctuality and regularity. You had an excuse when you were in a building that was not comfortable. That excuse is no longer there. So whenever we come here, we expect to see the full complement of staff. In rain or sun, snow or sleet, whatever situation, you are supposed to be here. In a building like this, we expect that when you come, because you can come and don't work, when you come that you will produce for the money that you are being paid to produce. So you are not just coming to be window dressing, you are coming to produce. And in a building like this, I expect you all to be polite to clients, to members of the public, to your colleagues. I expect you all to be courteous. I expect you all to be efficient, because there is no reason why somebody working here will not be able to come to work, will not be able to perform, and will not be able to be polite. And on the question of politeness, I want to throw your minds, the younger ones may not know, my age and above, or a little younger than me, there was a people's doctor in Tobago. The 1970s, the 1980s, and for most of the 1990s. He passed away in the late 1990s. And he was truly a people's doctor. He was polite. He was full of charisma. And I tell you, he was liked by the men. He was loved by the women. He was well loved by young women. If you wanted to be in the first 5 to 10 patients when he started at 8 o'clock, you had to leave home after 6, because there was always a big crowd waiting to see that doctor. And you know something? I, most times, used to have to think hard when I went in to see him what I really came about. Because from the time he started talking to you in that soothing, empathetic voice, you feel better. You cannot even remember what your ailment was. And I would like our medical practitioners, if you did not know about that man, I would like you all to emulate some of those qualities he had, where no one was afraid to go to him. Now you will hear people saying they're afraid to go to so-and-so doctor. They're afraid to go to so, because they don't know how to speak to people. So, and because they don't know how to speak to people, persons are reluctant to go to state what their complaints are. Almost 30 years ago again, I was confined to complete bed rest for 5 weeks when I was pregnant. And the doctors, nurses, nursing assistants, wardsmaids, oh, they were so beautiful to me. I think I was the most popular patient in that hospital. They were always at my bedside. It had nothing I could have asked for. I didn't get. But you know, it cost me, because when I was discharged, I had to be buying tokens and cards and all kind of things. So because they were so nice to me, I had to pay for it, because I didn't think I should have left it unsaid and undone. Right? I had to show that I appreciated how they treated me. So the point I'm trying to make, there are nice nurses, nice doctors, nice nursing assistants, nice wardsmaids. We just have to work on it to bring out the niceness in them. And I'm telling the clients, the general public, please come here to see about your health. This is a primary health care institution. Don't wait until it's too late and your relatives have to rush you to the secondary health care just in time to exhale. Come here, get your symptoms reversed, get good health care. We have all modern technology here, all the modern equipment. You will be attended to by smiling nurses. They will be here for 8. They will be working until 4:15. Have no fear about that. And thank you, and good health to everyone.